I just did a video on choices at admission, and so many of you guys were out there wondering, okay, what are my choices about fetal monitoring? I wanted to make a whole video on this. Now, it's not super complicated. These are some easy choices to make, but it's not information that a lot of people have. So I'm glad that you guys are here to learn about it. I just realized I need to switch into my pickleball shirt because I know a lot of you guys are thinking that fetal monitoring, we're monitoring, this is the QRS wave of the heart. Fetal monitoring is not like that, but I thought this was a fun way to talk about fetal monitoring with my pickleball shirt on. If you're a pickleball fan, tell me down in the comments. So there are 3 different types of monitoring. Well, I guess there's 4. You could entirely refuse monitoring in the hospital. I'm going to tell you that that is going to be met with a lot of nervous nurses. I would actually say that I almost feel like that is unfair to come to the hospital, refuse all types of monitoring, but still want the hospital to engage in helping you out. If something goes wrong, how will we know? Anyway, there are other kinds of monitoring. Please don't just entirely refuse monitoring. And if that is your plan, please talk with your provider about that in advance. Okay, we're going to start from the least monitoring to the most monitoring. But I am here to tell you that if you are planning on an epidural or an induction, you are headed straight to the most monitoring. We have to use the largest amount of monitoring for most inductions and if you have an epidural. So that's just something to know ahead of time. That doesn't mean that prior to a Pitocin induction, you might be able to have some of this lesser monitoring. But once we start into Pitocin and an epidural, you definitely need continuous monitoring. I know a lot of people out there say that, oh, you can refuse anything you want in the hospital. But if you were to say, I do not want my baby to be monitored, I would actually have to stop either the epidural or the induction because I cannot run those medications without having the baby on the monitor. That's just something that's important to know. You can refuse it. Obviously, you can refuse it, but you will ultimately refuse the induction or the epidural at the same point in time. Okay, the least amount of monitoring is something called intermittent auscultation. Now, I have a whole video on intermittent auscultation, but I just want to give you 3 facts about it that I think it's really important to know. First off, a lot of people talk about it online. They're like, oh, use intermittent auscultation. It's so great. But I'm here to tell you fact number 2 is that most hospitals don't actually do intermittent auscultation. And you're saying, Hillary, why on earth can they not do it? First off, it is a completely different skill than the other types of monitoring, and most labor and delivery nurses don't have that skill. Now, your hospital may have it. So this is a great one to ask your provider about if it's something that you can do versus something that you can't do. Because if your nurse literally does not know how to do it, it is not a safe way of monitoring your baby. And if you want baby to be monitored, this wouldn't be for you. However, all of the governing bodies around birth do show that intermittent auscultation is the safest way to monitor your baby in early and uncomplicated births. So that's something to be aware of. Again, most hospitals don't do it, and there is no place to chart it. So even if I had known how to do it at my last hospital, we did not have a place to chart it. It is an entirely different set of charting, which I know you're like, Hillary, why does that matter at all? But it matters a lot to labor and delivery nurses. So that's just something to be aware of. So if you are planning on intermittent auscultation, which can be a great option, talk with your provider. And if your hospital doesn't offer it, I would give a call to their manager and say, you know, I'm considering not going to your hospital because you don't offer this great low risk option. I wish more hospitals did it. I wish more hospitals offered it. I wish more labor nurses were trained in it, but we have to work in the system that we have. And if it's something that you wish that you could have used, make your voice heard, because that's the only way that we are going to make change in this industry. Okay, like the mid-level, which is what most hospitals offered when they say intermittent, is actually intermittent monitoring. So with intermittent auscultation, you actually use a Doppler, which is the same thing they listen to baby with in the doctor's office. However, in the hospital, we have an ultrasound monitor that picks up baby's heart rate continuously, and they can do intermittent monitoring, which means you're going to have the baby on the monitor where you can see the baby's heart rate and then also your contractions. So you can see all of those on the monitor, and most often hospitals want to see baby on the monitor for about 20 minutes out of every hour. That's called an NST. And then, you know, if we see anything wrong or wonky with the baby, that time can extend or whatever. So that might be an option for you if you are in a low risk pregnancy environment and your hospital doesn't offer intermittent auscultation. It can be a good option. Now, a lot of you are going to be like, why does anybody care about this? So in order to monitor your baby, sometimes we have to have you in a specific and possibly annoying position. Now, people online are going to be like, oh, Hillary, but they have wireless monitors. But I'm here to tell you that they are not the fix-all that we wish they were. Like my whole career, I wished for wireless monitors, and then we got them and I was like, this isn't what I thought they were going to be, because I don't know that they're all that much better or helpful sometimes than the wired monitors. Again, I have a video all about wireless versus wired monitoring that I'm going to put the link for down below. But if you don't want to be in the position that we need to have you in order to monitor your baby, be it wired or wireless monitoring, you might want to be off the monitor during that other time to move about your room freely and just enjoy your body to yourself for a little bit of time. So that can be an option for people. I will say that most people come into the hospital do not want baby off the monitor very much of time. Of course, they want to be off to go to the restroom, maybe to walk around the halls for a little bit, but they really appreciate being able to see the baby on the monitor. Is that the safest thing? Again, check out my video for intermittent auscultation. It's going to walk you through more of it. Editor Hillary here. I felt like I left you on kind of a cliffhanger there. I would totally recommend that video, but just the cliff notes as to why intermittent auscultation might be safer is that the more we watch you, the more problems we could find and ultimately possibly end for a C-section or something like that. So that's what Editor Hillary wanted you to know. Then the highest level is continuous monitoring, which means we have the baby on the monitor all the time. Now, we might unplug it for you to go to the restroom, things like that, but ultimately we're trying to have the baby on the monitor all the time. And that's important for an epidural or an induction of labor because we need to see how baby's doing, and we also need to watch your contractions. So in continuous and intermittent monitoring, there is a line for contraction that looks like little molehills. And then there's the top line that's the baby's heart rate that looks like a squiggly line. And nurses spend a ton of time in classes to learn about how to understand that monitoring, what it shows, what baby is going through, and how to react to it if we're seeing something that's wrong. As a labor and delivery nurse, you spend 75% of your day just watching monitors. You're watching both your patient's monitor, but you're watching everybody else's monitor because we love to have lots of eyes on babies at labor and delivery. So those are your different options for monitoring in the hospital. And you're thinking, God, there are choices in the hospital. And I'm here to tell you that a lot of places, they don't tell you these different choices. They don't say that you can get off the monitor. If they offer it, they may not say intermittent auscultation unless you ask for it. Learning your different choices in labor and delivery can be huge. And I have a whole birth class that I recommend that goes through choices like this. I'm going to put the link for it down below. What other choices are you interested in labor and delivery? Because you win YouTube by making the videos that you guys want. So tell me down in the comments. And again, I would totally recommend checking out that video about wired versus wireless monitoring, because I think that's really important to know about, especially if you've seen information or you want to use it. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth. Be sure and like and follow this video because we really appreciate it.